thank you. So just a bit of background for me. I've been in the NHS for over 40 years. All of that pretty much was in intensive care. I was the nurse consultant for intensive care and worked nationally and locally and was involved in research and publishing. And I absolutely loved my job. But the Lord had other ideas for me. So I surrendered all of that a year ago and became a parish nurse for Southcote and Coley, which are two deprived areas in Reading. There was a complete blank sheet. We'd never done. I hadn't even heard of parish nursing before. And to kind of contextualize that, it's only 20 years in the making, so it's a relatively new concept in nursing, but it's growing quite rapidly across the nations. So when we think about health and whole health, I think when we look at the Bible's understanding of that, that's kind of physical, mental and spiritual. And I think there are really good examples in the Bible of what that looks like. So from the beginning of time, looking after each other, caring for each other, and the wholeness of each other was really important. And if you look at the model of Jesus, he went to the extremes, really, to include those that were on the fringes of society, to recognise them, to journey with them, and to make them whole and bring them that shalom. So that's really the foundations for parish nursing. I think Florence Nightingale, again, her faith was a great driver towards all of the work that she did. And I think with the medical model, if we look over time, was maybe more focusing on physical, and latterly we're more aware of mental health. But I think there's a real awakening for spiritual health being seen as part of that wholeness today. So I do feel that in today's healthcare and faith landscape, there's an opportunity for churches to awaken and maybe offer an alternative or an addition to the statutory bodies of NHS and other facilities that are available. And in the 10-year plan, there's very much a big focus on the neighbourhood health service, and that's seeking collaboration with all statutory bodies, but also the voluntary and the community. And faith is definitely in there, which is great to see, and working along those in social enterprise as well. And the focus is very much from hospital to community and from sickness to prevention. There's really big, they call them the left shifts, but to really try and readdress and focus health in a different way that is more meaningful to those in the communities that we serve. So for me, what I've learned about the parish nursing model and what I see day to day is that parish nursing is unique. It's unique to the communities that it serves, but it brings whole person healthcare through churches to the communities. And I think there's a real statement that health is more than the absence of illness, but it's actually the presence of care. And in part of that care is that we are encouraged and enabled to pray for our clients as well. Next slide, please, Mark. So where I work, bit stuck.
All right, it's not moving for some reason. There we go.
Perfect, thank you. So I work in Southcote and Coley, and they are two deprived areas in Reading. And there's lots of data to look at the level of deprivation and how it links with long-term conditions and also the inability for these people to access health. So for instance, in the communities, if you haven't got a mobile phone and you haven't got internet already, it's a real challenge to access a lot of the things that are on offer in health. And I have learnt a lot and daily astounded by the lack that people have, and maybe the lack of finances to have these facilities, but also the lack of knowledge and understanding and confidence. A lot of the people I journey with feel like they've lost their voice, and they're judged quite significantly for many different reasons. They feel that way. So these are some examples. So there's some lovely areas of where I work, but also there are some real high levels of deprivation. And with that level of deprivation, evidence suggests that they have an increased risk of mortality at an earlier age. So it's really fundamental that we kind of help to enable them to access health in a more meaningful way. And I serve, so the usual model of parish nursing is a church will employ a parish nurse, and they will serve the congregation as their community, but also linking out further into the community. But I serve 5 churches. I'm not affiliated to any one of them. And they range from Anglican, Baptist, Pentecostal, Free Church, and a whole array of denominations. So I'm learning fast about church as well as I am about health and wellbeing. Next slide, please, Mark. So when I started, so there are probably about over 22,000 people in the patches that I serve, and I kind of thought, new to parish nursing, didn't know where to begin, complete blank sheet. And for me, I was really blessed to go to each of those churches and attend everything that they offer. And each of those areas have pantries. So pantries are for people that have low income and have difficulty accessing healthy foods. And they come along each week to not only choose healthy foods or choose food, but also to get alongside each other. So there's real communities that are growing in these places. And it's a real privilege for me. So I first started just basing myself in both of those each week and started building relationships of trust. Getting alongside people, listening to their stories and helping them in whatever way I can in terms of signposting, referrals, attending GP appointments with them, enabling them to have a voice in that space. Some of the, so I would say that I probably spend 2 to 3 hours there a week in each of them, and I probably speak to 10 to 15 people, all with a variety of things that they want to talk about. So one lady on the screen came to me to speak to about recent falls that she was having. So we looked at what might be causing those. But at the end of the conversation, she broke down and spoke about the loss of her husband and how that had impacted her. So you never know where these stories are going to go and what you might be talking about. Some of them, like one of the pantries, I spoke about a man who just had a dog bite, hypertension, women's health and heart health particularly, weight management, diabetes, like the whole range of things. So I feel really blessed that nothing is wasted in the Lord. So all of that experience that I've had in intensive care, where we see every combination of comorbidities and illnesses, I've been able to use that experience in this space. And I think understanding the NHS is really crucial, because you need to understand how that works and how to signpost in and how to advise people and journey with them through understanding that. Next slide, please. I think one of the things that the Lord really showed me first off was like one by one. Like, listen to me, I will show you, and one by one we'll learn through clients. So this was my very first referral. When we had the parish nurse training, they said you'll never get a request for prayer or any, it just won't happen. And my very first referral was a gentleman who was journeying towards the end of his life. He was housebound. He was main carer for his wife, who has schizophrenia. And the request was, I need to get right with God. How can I do that if I can't get out of my home? So that was like a real privilege for me. So my first meeting with him, it was really establishing what was important to him in his faith. And it very quickly became obvious the Lord's Prayer and Psalm 23 were very much his era. And so every time we have prayed the Lord's Prayer, and he now speaks of the Psalm 23. But we built relationships over time, and I was able to link with Torch and the Torch volunteers to enable us to get into appointments at the hospital, to advocate for him, to navigate systems, even to the point of having hairdressers. But one of the highlights was having Holy Communion in his home. And he got admitted to hospital just before Christmas, and he asked if we could go and give Holy Communion there. That's what those pictures are. That was just such a privilege to be able to take it where he was, and to have had that trusting relationship was really key. So journeying with them, I've been involved in safeguarding referrals as he had multiple falls, hospital admissions, working with statutory bodies, including social services. And there's a real, in my experience, there's a real openness in both of those places. Often when I go to the hospital, they know me, and they're kind of like, what's a parish nurse? And so it's a really good way to show them what parish, and the gap that parish nursing, so we're not in competition, we never replace anything that's already there, but we're able to journey with these people and advocate for them. Next slide, please. So one of my first difficult situations was I was referred a lady who had fled. She fled from her original home because of domestic abuse. She had a 5-year-old daughter who has special educational needs. And this was her, she'd been moved twice before she got to this. This was her permanent home. So there was no flooring. She was on a ground floor flat. Drug dealing happens outside those windows, and she couldn't conceal the windows. She had no cooker, no kettle, no heating, nothing really. But over time, we've been able to journey with her and build that trust to the extent, could you just show the next slide, please, Mark? That we've been able to kind of build that confidence, and this is now her new home. This is a home that we had before, but through journeying with Torch, we've been able to get the flooring done, the rooms painted, curtains up at the windows, get her a washing machine, understand the disability living allowance so that she was getting the right money that she needed. Was able to advocate at GPs with her for her to have a voice, because she just, to get a GP, she didn't have a GP or a dentist, so we've got those in place. Been able to help her with form filling, but also now her confidence has built to the point that she's volunteering at a local Christian charity shop, and she's slowly building her confidence. But she said to me the other day, I'm beginning to become myself again, and I now have hope. And like, for me, that was just like wow. Like, if you need a measurement of your job, I know it's about numbers, but actually things like that are like really important. The journey's not ending, and I guess that's one of the challenges with parish nursing, is when do you discharge these patients and these clients. But it's been a real privilege to journey with her. We do pray together. On my first visit, we looked at her mattress, and under her pillow was a Bible. And she said, this is the thing I cling to. So we've been able to talk, pray together. Next slide, please. So just 2 more slides, just to talk about the prevention side of things. We're working on health education and promotion. Those people that came to Pantry were unsure about how to blend food, choose food, cook foods. And what they asked for was some guidance in how to cook. So by listening to them, they're shaping their needs. Their request for life skills and confidence in social skills was being addressed. And so we had just, week 5 now, tomorrow, we'll be doing a pilot of a Ready Cook proposition. And alongside this, so the biggest driver for this was actually lots of mums didn't know what to pack for their children's packed lunches. And so we're just demonstrating how we can do healthy packed lunches and not processed food. So this is part of it. But one of the spin-offs we've heard very much is about the pastoral care that happens between the group, as well as between, as Alison, you can see there in the black, who was doing the teaching, but journeying with these people in a different way, but them journeying together and building their own communities. Next slide, please. And one of the other things that they came up with was seated exercise classes. So we've done a couple of taster sessions doing exercise classes. I thought it was kind of quite an easy thing to do, but trust me, it's not. It's quite challenging to do it. But again, there's a real need for that in both communities. So our kind of answer to that will be we're encouraging, there's a company called Get Berkshire Active, that are a charity in Berkshire, and they've suggested that I get trained and run my own courses. So we'll see how that goes. But one of the other things that has really struck me in all of my conversations is people's inability to process grief and loss, and how they get stuck in that process. And in some cases, there's unresolved anger, and it leads to mental health problems. So we've just journeyed with At a Loss, the bereavement journey, and we've just done our training, and we're registered with them. And again, we're hoping in the future to be able to run these courses in both those areas. I think that's my last slide. Thank you.